Hi, my name is Jill Bourne, and in this video, I will break down the components of the medical model and the ecological model used in educational and school psychology, and compare the two. I will dive into the research of Urie Bronfenbrenner and Albert Bandura and discuss their work and how it contributes to the ecological model. When looking at the medical model is going to focus on curing internal pathologies by utilizing the DSM to make a diagnosis and develop a treatment plan. So the medical model really poses the question, what is wrong with you, and is looking for a label or diagnosis to treat the patient or student. The ecological model is going to consider external environment and behavior functionality. It's a multi-systemic process, and it poses the question, what is preventing you from fitting into this environment, as opposed to what is wrong with you. So if you compare the medical and ecological models side by side, you're going to notice that within the medical model, the focus is on labels, as previously mentioned. Within the ecological model, the focus is on the environmental influences that surround the child. In the medical model, you're looking at more of a diagnostic category or diagnosis, and within the ecological model, you're going to be providing a multi-systemic intervention process. Within the medical model, you're providing treatment or prognosis, and within the ecological model, you're looking at things through more of a preventative perspective. Within the medical model, you often will see prescriptions being prescribed. It's more of a reactive approach, versus the ecological model, you have a proactive approach with consultation and how to best move forward. Within the medical model, as I mentioned before, you're really posing the question, what is wrong with you, versus the ecological model, where you're saying, what is preventing you from fitting into this environment. As noted by Terry Gutkin in his article, Ecological Psychology, Replacing the Medical Model Paradigm for School-Based Psychological and Psychoeducational Services, Urie Bronfenbrenner studies denote that a child's nature is dependent upon the environmental context in which they grow up in. As a result, Bronfenbrenner developed a system made up of 4 interrelated systems: the microsystem, mesosystem, exosystem, and the macroenvironment. Later, he added a 5th system known as the chronosystem to illustrate the influences that one system can ultimately have on the others. His organization of the 5 interrelated systems was designed around the amount of impact the system has on the child or individual and their life in regard to the influence of the social environment. According to Bronfenbrenner's theory, if one changes their environment, then as a result, they will inadvertently change as well. In conclusion, the benefits to using an ecological model are clearly evident. It is not logical to try and best meet the needs of a student without fully examining environmental factors surrounding that child and utilizing parental support, teachers, admin, and the school environment to the fullest extent possible. The ecological model aligns more closely to the domains of educational psychology and the responsibilities of a school psychologist. It is not the job of a school psychologist to diagnose students. It is our job to help a child succeed academically or cognitively, behaviorally, socially, emotionally, and in some ways physically.